The federal government has announced that the COVID-19 vaccine is only approved for those over 65 and people at high risk. Reporter Isabella Vesperini has more on how these restrictions are creating confusion and hesitation.
When Jimmy Healy's 18-month-old daughter was hospitalized with COVID-19 last month, Healy was thankful she had at least gotten the vaccine beforehand.
How much worse could it have been if she didn't receive the vaccine the first time?
Under the new federal government's guidelines, she's not eligible to get the COVID-19 vaccine anymore. This is extremely concerning for Healy, who thinks vaccines are necessary to protect against severe illness.
You're trying to keep up with the virus itself, and if we can't get those vaccines, you can't keep up with the virus.
In a social media post last month, Health and Human Services Secretary Robert F. Kennedy Jr. said those under the age of 65 without a high-risk health condition must consult with a doctor to be recommended to get the vaccine. This comes after the CDC has recommended for years that most people over the age of 18 and those at high risk get the vaccine to be better protected from strains and to decrease the risk of long COVID. As a result, demand for the vaccine has risen at Traders Point Pediatrics in Indianapolis.
Parents want to be able to choose whether or not to give this vaccine to their children, and they're worried that that choice will be taken away.
Even though the CDC recommendations have changed, Dr. Boslets haven't. She'll still help those who want the vaccine get it.
Knowing that those age groups are higher risk for hospitalization and death, those are the children that we're really going to work with to make sure they can have access. And then we firmly believe that any parent who wants to be able to protect their child from COVID, regardless of their medical conditions, should have access to that.
Experts say these new restrictions are confusing and could make people more hesitant to get the vaccine.
When we see an erosion of trust or we have uncertainty, usually that leads to decreased uptake or confidence in vaccines.
Vaccination rates are already low, with just under 15% of people ages 6 months to 17 years getting a booster in the last 2 years. And as of May last year, only 13.3% of pregnant women ages 18 to 49 got the shot. If fewer people are willing to get vaccinated, that can mean higher infection rates and a decrease in immunity this winter.
And over time, just that natural immunity wanes, and then the virus also changes, and then we're susceptible again.
A Centers for Disease Control and Prevention survey found that nearly 40% of adults chose not to get the 2023-24 COVID-19 vaccine because of concerns about serious or unknown side effects. About 34% had a lack of concern about getting sick. 26% believe the vaccine can't prevent infection, and 24% reported they don't trust the government.
When vaccines work, and when they work well, there's nothing to see. So prevention, which is our primary care business, it's invisible. So no one gets very excited about things that you can't see. What happens is people forget about things like measles because we don't see them anymore. And so then they think, well, wait a minute, why do we even care about the vaccine then? It's not, measles isn't a problem. And so it's easy to just sort of think, I'll just skip it.
Amid these changes, McKean doesn't think COVID-19 vaccination rates will recover anytime soon.
We need a really concerted effort in public education and public health education and science communication about the benefits of these amazing tools that we have, because they do work.
As a scientist who has worked with vaccines before, Healy sees these restrictions as an attack on science.
My biggest concern is that COVID-19 vaccine is just the start of a long tirade that's going to be a fight against some of the best weapons, I would say, we have against illness. These are very well studied aspects of medicine, and so the fact that we could possibly lose out on that has me a little nervous.
For Indiana News Desk, I'm Isabella Vesperini.